Okay, well, this very long journey that started the day after Memorial Day, almost a year ago, is coming to an end. In some ways, I always think of the workshop final briefings in the spring as your real graduation. This is when all the things you've learned over the course of the past 3 semesters get brought together in a problem-solving exercise, which demonstrates really what you've learned and what the purpose of the curriculum is and what you and your faculty have worked together to achieve. And those of us who went to the practice sessions for the briefings last week were impressed by the first draft. We're now ready to be impressed by the final draft. And then, of course, you go and talk to your clients about it. These projects are, I think, a real public service to our clients and to the field, and there's something to be proud of. So with that, let me introduce our first group, which is going to talk about infrastructure and water. So if that group is ready, let's begin.
Thank you. This is Catherine Flowers. She grew up in Lowndes County, Alabama, and has been a tireless advocate on behalf of Alabama residents like herself who have been living without proper sewage systems. These are classic third world conditions in the richest country in the world, she said. It makes absolutely no sense. Good morning. My name is Lenny Simon, and I will be presenting Neglected Communities, a Rural Wastewater Crisis. I want to thank our team, and especially Dr. Nancy Degnan, our faculty advisor, for all their hard work. Today, I'll introduce our client, Democratic Congresswoman Terri Sewell, and provide context for the issues that Catherine Flowers and thousands more face in rural Alabama. Next, I'll talk through our team's objectives and discuss how we conducted our research and analyzed this situation in Alabama before getting to our findings and recommendations. This is our client, U.S. Representative Terri Sewell. She's been a national champion for Alabama and the nation on federal wastewater policy. She helped secure an additional $1.8 billion for water and wastewater programs through the Farm Bill in 2018. Additionally, she introduced the Rural Septic Tank Access Act, which became law in December of 2018. Both increase funding for wastewater systems through the USDA and represent significant federal action on this issue. So why is this such an issue for Congresswoman Sewell? Let's take a look at one of the counties in her district. A majority of this district is in the Black Belt, a region known for its rich, dark, impermeable clay soil and majority African American population. A survey of Lowndes County found that 50% of homes had failing or no sewer systems at all. Rural wastewater failure is pervasive in the state of Alabama. Here's why. Septic tanks, commonly used in rural areas like Lowndes County, are failing due to impermeable clay soils that prevents them from draining. When septic tanks can't drain, they fail. Many homeowners don't have the financial means to fix or replace these systems, leaving them with no good options. They resort to a makeshift method, simply connecting a PVC pipe directly to their toilets and flushing the wastewater out. Where septic tanks fail, or straight pipes exist, raw sewage can flood yards or back up into one's home. This has resulted in a number of public health effects. One of the most devastating of these effects is the prevalence of hookworm. Hookworm is a life-threatening parasite that's contracted through dermal contact with fecal matter. Hookworm typically exists in areas of extreme poverty around the world and was thought to be eradicated from the United States decades ago. A peer-reviewed study conducted in 2017 estimated that 1 in 3 people with failed sewer systems in Lowndes County have hookworm. This brings us back to our client, Congresswoman Sewell. Speaking in Lowndes County, she said, "In this day and age, everyone should have access to quality, affordable wastewater systems." Although Congresswoman Sewell was successful in passing federal legislation to address this crisis, there is a concern that these communities will not get the federal support they deserve. That's why Congresswoman Sewell asked us to assess wastewater system failures, identify common themes, provide recommendations for Alabama and the United States of America. To achieve these objectives, we conducted original research and consulted secondary literature to help us understand this systemic problem. We conducted 18 phone interviews with people working in a variety of different sectors, including senior federal officials, community organizations, nurses on the ground, university researchers. We analyzed our research and synthesized our findings. Additionally, we completed 3 in-depth case studies, which helped us to develop 11 distinct recommendations. Our analysis of Lowndes County, Alabama served as a baseline case study. We identified several key components that contribute to this problem in Lowndes County: poor soil permeability, rural or unincorporated communities, the financial constraints of poverty, and finally, a poor capacity at multiple levels of government to effectively respond. The conditions in Lowndes County are so severe they've had international political implications. On the left is Philip Alston, the UN Special Rapporteur or Investigator for Extreme Poverty and Human Rights. He visited Alabama in 2017 as part of a report on poverty in America to see these disturbing conditions firsthand. His report was submitted to the Human Rights Council at the United Nations and made international headlines. The U.S. government responded at the highest levels, with former U.S. Ambassador to the UN, Nikki Haley, saying, quote, "It's patently ridiculous for the United Nations to examine poverty in America. America is the wealthiest and freest country in the world." The failure of a coordinated government response to these egregious conditions is the largest barrier to addressing this issue. This crisis has existed in Lowndes County and other areas in rural Alabama for decades. In Alabama, like many other states, homeowners are legally responsible for proper treatment and discharge of wastewater. The state of Alabama has arrested at least 10 residents for improper wastewater discharge, all of whom are African American. These people are being punished because they cannot afford a better septic system. Recognizing that federal and state government can do more to address this issue allowed us to examine 4 main factors that contribute to this crisis: that poor soil conditions and a lack of affordable technology, rural communities and a lack of data to understand the scope of the problem, poverty and a lack of private funds to address it, and governance failure resulting in poor wastewater management and policy. At the request of Congresswoman Sewell, we were charged with understanding this crisis from a national perspective. Lowndes County isn't the only place grappling with wastewater system failures. The dots on the map represent additional places in the United States struggling with some of the issues I have described today. Further, it is estimated that over 1 million Americans live in unsafe conditions due to failing rural wastewater systems. The actual number is unknown. I'll highlight 2 towns in the U.S. that experienced septic tank failure and briefly discuss how the government responded to this issue. Dawn, Virginia, 2003. Community leaders engaged county government to help secure $1.8 million in federal funding. Through civic engagement and government intervention, every house gained functional wastewater infrastructure, and Dawn won the All-American City Award for their civic accomplishment. PARKLAWN, California, 2016. In PARKLAWN, the state was able to step in with an innovative financing mechanism called the Clean Water Revolving Fund that helped hook up houses to a neighboring municipal sewer system. Based on our analysis, we developed 11 recommendations, 4 of which I'll be sharing with you today. The first, for the technical challenges, we recommend that government fund innovative on-site wastewater solutions through prize programs and research grants with the goal of bringing emerging technologies to market at scale. To address the gaps in data, we recommend the creation of a national repository for collaborative data sharing to host published data and resources as an open access portal for all, with the goal of reducing silos among researchers, organizations, and communities. For the financial considerations, we recommend a state bond program in Alabama and federal maintenance funding. In the state of Alabama, this would help with the flexibility of financing, allowing homeowners to get funding directly from the state with the goal of increasing state funding and addressing gaps in federal funding. For governance, we recommend a task force on rural wastewater at both the state and federal level, which will help consolidate government, nonprofits, universities, and community group efforts to facilitate collaboration with the goal of establishing government accountability and building trust. It's important to remember that this situation is a reality for over 1 million people in this country who are unsafe because of non-existent or failing wastewater systems. Many, like Ms. Flowers, have had to live with these devastating living conditions for decades. There's a lot of momentum on this issue at the federal level. This is a difficult and complex issue, but it's one that merits attention and further research to bring these communities closer to a solution. No one should have to live like this. Thank you, and I'll take any questions.
We
have one?
Good.
Thank you, Tabo.
I was wondering, in your case studies, did you notice any sort of threshold in terms of the level of income in these areas where, above a certain income level, even if you have some of the other soil or kind of technical challenges, that with a sufficient income level you didn't see these problems, or was there a range in terms of how these communities were doing financially, although obviously still kind of rural and dealing with some level of poverty?
So are you asking if there's a threshold in terms of the poverty demographics that we've looked at where you see these issues popping up?
Yeah, I guess if there were, if you saw any strong signal that, if a community as a whole has a certain level of, average income or something like that, that they wouldn't face these problems, but if they drop below that, they're much more likely to be at risk?
Yeah, I think we've seen a lot of evidence of that. I think specifically in Lowndes County, I believe that there's 37% of African American population is below the poverty line, whereas 4% of the white population is, and that we see this issue predominantly in the African American communities.
Any other questions? One more. Okay.
Thank you for your presentation. I was wondering, for the technical part of the solution that you mentioned that there can be a prize program or research grants to see if there's any new solution for these kind of problems. But if this is a problem that happens in America, I was wondering whether this is a problem that happens in a lot of places in the world, and whether there's any already, not best practice, but innovative ideas that they can probably just use in Alabama or try, that you have ever looked at?
Yeah, there are a bunch of really innovative solutions that are coming out, and Manu Lal at the Water Center has been working tirelessly on some of those issues, specifically in Lowndes County, but also around the world. And we hope that one of the issues is that this is a sort of emerging field in certain ways. We don't know how these systems are going to last for 10, 20, 30 years. So it's really doing the research to see how they'll hold up over a long time frame.
One more we have over here. Professor has a question.
So is there any evidence in Lowndes County? Oh, sorry. Is there any evidence in Lowndes County that that your neighbors are affected by your poor sewer system? I mean, one of the things that we often see, like for measles, right? The reason the measles outbreak is happening here is not necessarily because just to the people who didn't get immunized, but to the neighbors of people. So is there evidence for affecting the neighbors' health, for example?
Yeah, there is. I mean, there's not a lot of research, so we don't know exactly how the sewage is flowing, but it is true that there's areas that are certain homeowners are adversely affected by their neighbors' actions, absolutely. The extent of that and the extent of the public health impacts from not an individual, but their neighbor's sewage discharge is unclear.